Hello, my lovelies, and today, welcome to Somato Enlightenment. We're going to talk about a little bit about what we talked about yesterday, talking about surgeries and how your body holds on to things when you are not conscious, and kind of how that relates to doing some intuitive movement. So yesterday, just kind of recap a little bit. Your body remembers everything that happens. It doesn't matter if you were sedated or sleeping. Your body is still it still remembers exactly what's happening to it, um, and things like that about what else is going on in the room when that happens. So you're never, when you're non-conscious, you're never unaware of what's going on. Sometimes it is just not, you just don't always have access to it because it's in your subconscious. So that's kind of part of what we're going to talk about today. And then also to kind of recap fascia again and why that's important is that your fascia kind of stores all this information. So it remembers the pattern that you were in when the trauma was introduced. So if you had like a surgery or something, surgery is a trauma, and it can, again, your body remembers everything, so it'll remember the exact position you were in when something happened, and sometimes your body wants to be in that exact position to be able to get out of that position. And the reason is because your fascia remembers a lot of things. Your fascia is your biggest organ. It covers all of your body. It pretty much covers you head to toe and everything in between. So it covers your organs, your bones. It even covers every individual muscle cell, and then bundles of cells, and then bigger bundles, and then it keeps going until you've got the entire muscle, and that fascia becomes the tendons on each side of the muscle that attach to the bone. And so everything is like covered in fascia, and it all talks together and communicates, and it's also really sticky. So sometimes when it gets pulled apart, it kind of comes back a little meshy and a little like not quite as smooth as it should be. So when it tries to heal and repair itself, so sometimes you have to work through that a little bit. And another thing about it is when you pull it apart, it actually is really sticky, and it actually looks like cotton candy. Very like has all these like strings and stuff that kind of come when you look at it underneath a microscope. It's actually really cool. So if you haven't looked that up yet, because I've mentioned this a million times already, you should, because it's kind of interesting. Body is fascinating. And so something to think about with, particularly with surgeries, is that, again, you're unconscious and you don't know exactly what's going on, but things are happening. And so today I'm going to go through one of my surgeries, just kind of doing some intuitive movement around it. I won't be going through my surgery like it's a play-by-play, like running a movie through my head, but I'm going to do another technique that is kind of more in tune with what we've been doing here. So just kind of give you a rundown of my surgeries. I have a couple of screws in my hand here, my pinky finger. I had my wisdom tooth taken out and I was sedated for that. And then I also have this plate that was put in when I broke my clavicle riding my motorcycle. And so with my shoulder, I actually have like at least 2 traumas. I played a lot of sports growing up. I played, sports in college. I played sports after college. So I've had probably a lot of trauma on, anywhere in my body, but my shoulder specifically, it's my non-dominant shoulder. But this plate, the motorcycle accident, the surgery, all of this has kind of been, something that can hinder me and change my range of motion, things like that. Again, your body remembers exact positions that you were in when things happen, so I'm feeling like there might have been something something stuck, or maybe I'm guarding with my heart a little bit because that pec muscle is a little tight and it's kind of keeping me rounded in a little bit. So these are all kind of things to consider with my shoulder. Shoulder is also kind of like how you work, how you do things, how you take care of stuff. It's shoulders hold burden. They also hold things like stress with especially when it's related to like guilt or like I don't know. So those kind of things kind of also get stored in different parts of your shoulder as well. So today I'm on the floor because I want to kind of show you about putting some different weight on your shoulder and different ways to kind of do that. And again, I'm going to trust my body that I'm going to move in ways that is specific for it and specific for my trauma. So again, I am just kind of going to think into my my shoulder just for a minute and kind of think about the surgery, think about that motorcycle accident. I wasn't unconscious for the motorcycle accident, but obviously for the shoulder surgery I was. So kind of thinking about that, keeping that in mind, and then just kind of noticing where and how my shoulder wants to move. And I am noticing that it really wants to kind of be in like this position. So maybe it just needs a little stretch a little bit more. I am noticing that my shoulder blade doesn't really sit quite flat against my back. So I'm going to kind of work on that just a little bit and see if there's anything that kind of wants to move through while I'm doing this. What I'm noticing is the outside of my scapula feels like it's starting to stick more to my my rib cage a little bit. I'm noticing as I move around, just kind of looking for that flow and where I want to move. And if I want to maybe turn this way a little bit, put some more weight on it. And it feels like in this position particularly, like my whole shoulder girdle is like coming in, like it's coming towards this hip over here, kind of like in a diagonal motion, and that feels really good. I am noticing that it feels a little tight, especially like inside my armpit. Just kind of feeling around if there's a good way that I can kind of get into that right now. It feels like doing a little stretch this way might be good, and just kind of moving around to kind of feel where, like here feels like a good place to stop. Just kind of take a little extra stretch here. It feels like my pec muscle is really kind of keeping my my scapula, my shoulder blade more forward tilted rather than posterior tilted or back, where it lays a little bit flatter on my back. And I'm noticing that when I bend my elbow, that changed things for my shoulder as well. It changed where it kind of shifted my shoulder blade from kind of being more around my rib cage in the front to kind of shifting back a little bit more, and again settling in that inferior angle of my scapula. So the bottom angle of my shoulder blade is kind of it's getting a lot of engagement at the moment. Moving around, it feels much different. Something like through here, it all feels a lot, mostly just through this back part here, feels a lot looser. I'm still noticing some tension on the top of my plate here. So I'm just going to move around my neck and see if anything wants to loosen up. And then here I'm really noticing an attachment right behind my ear here. I'm also noticing that as it goes out my trap, out to the tip of my shoulder, how that changes things. Moving my shoulder around as I move my head might feel good. Again, now I feel like I need to stretch that pec again as I'm stretching my neck. And then also, once my body's like, oh, let's bring back the other shoulder and really squeeze those shoulder blades together. So lots of engagement in my rhomboids, those muscles in between my shoulder blades. And I can notice that my hands are in different positions right now, but I can notice there's a big difference between my left shoulder blade and my right shoulder blade in the lower angle, that inferior angle, where it feels like my left side is just sitting right on my rib cage, whereas like now when I'm back in engagement here, the right is still popping off just a little bit. And I am, again, obviously my arms are in different positions, so that will affect things, but that's something that I should note and think about. And now when I kind of feel into both of my shoulders, I am noticing that this one, my left shoulder, is sitting, that scapula is sitting in a better position. And again, what I mean by that better position is that your scapula should be kind of flat against your back. I've had trouble over the years with some winging scapula, basically like the bottom part of my scapula just kind of poke out a little bit. And so that feels like it's helping it. It also feels like it just engaged that bottom part of my rhomboid that might not be as engaged as it normally is. It's normally probably one of my weaker muscles back there, especially since I have that winging scapula kind of happen. I am noticing that I do have a rotator cuff muscle that kind of comes through, and how that is changing things as I rotate. There's also another muscle that is in there that feels like something's not quite right. So just gonna see where this goes. I feel like so I notice my hand, how it's moving right now, and it just feels like again, I'm just letting it kind of do whatever it wants, and now it's behind my back, and I'm noticing like my shoulder blade was popped out, but then I just moved my elbow out like this, and that changed things with my shoulder blade as well. I'm gonna let that one go and see what happens. Now when I rotate my shoulder around and kind of move it around, feel into both shoulders, kind of feel what's happening. They feel, again, this side is feeling much better than this side. Normally my right shoulder is the better shoulder, it's my dominant shoulder. So that's kind of something to think about too as you go through things like your dominant side versus your non-dominant side. Notice if they feel equal before, and then what changed during, and then what changed after. So those are also some good things to keep in mind as well. I think that's about it for today's video. I hope you enjoyed it. I hope it gives you a little bit more insight on how to think about when you're trying to release specific things, like again my shoulder for this shoulder surgery, and things like that. So I hope you enjoyed today. Again, this is Somato Enlightenment. You can check me out on YouTube, Facebook, and Instagram. Thanks.